I'm Alan Morris, and with me is Tyler Coulander, and welcome to today's podcast, DME Meeting Today's Biggest Healthcare Industry Challenges. Before we get deep into introductions into today's podcast itself, I first want to introduce VGM Industry Insights, a program Tyler and I have worked hard to develop. Through VGM Industry Insights, we'll provide data-driven analyses and trends within the DME POS sector. Our focus will be market trends, both within DME and across the broader healthcare ecosystem as it relates to impact and opportunity created for DME. We'll focus on strategic decision-making and focus on helping key stakeholders, both VGM's member partners and our vendor partners, stay informed and competitive. So we're committed to a forward-thinking approach and continuously monitoring industry developments to drive progress and innovation. So with that said, again, I'm Alan Morris. I'm Senior Vice President of Strategy for VGM Associates. I've been with the organization for a little over 2 years now, but my background with VGM and in the DME industry is much deeper than that. So I started with VGM back in 2007, stayed with the organization till about the tail end of 2014, so almost an 8-year run where I traveled the country talking with members, educating on things like competitive bidding, healthcare reform legislation, played a number of different roles that all sort of revolved around the strategy and analysis space. From there, I went to work for a health system in the analytics space where I got a deep inside look at how the rest, outside of DME, how the rest of the healthcare ecosystem works as it relates to payer contracting and finance and operations, how the clinical world works in that space, a whole bunch of things that really relate heavily to DME, especially when we look at providers across health systems as referral sources. So I did that for about 8 years. And then, as I mentioned a little over 2 years ago, I came back to VGM, where given the opportunity to be in this role and certainly excited to use my expertise both within DME and across the broader healthcare ecosystem to work with Tyler and drive this Industry Insights program. So with that said, Tyler, why don't you introduce yourself?
Yeah, thanks, Alan. I'm excited to be on the podcast today. My name's Tyler Coulander. I've been at VGM a little bit over 6 months. My previous experience before my time at VGM is also in the nonprofit healthcare space. Worked for a couple different healthcare systems in roles ranging from patient access to operations, project management, and finance. I received my bachelor's degree in business administration with a focus in healthcare from the University of South Dakota and a master's degree in healthcare administration from the University of Iowa. Really excited for our Industry Insights program. The program kind of consists of a couple different things. The podcast that we're doing today, there'll be blogs as well as some branded and marketed reports that will include industry trends and insights of not only things that come from the DME industry, but also, as Alan mentioned, the broader healthcare continuum and utilizing the knowledge that we have collectively to understand key trends and happenings within the healthcare space and keep our audience here at VGM educated on those things. So with that being said, our first topic for the podcast is talking about healthcare challenges across the entire healthcare continuum for DME referral sources specifically. So across several industry publications and market research, we've kind of come up with 4 different challenges that we'll be discussing in more detail today. Improving access to care, addressing staffing shortages, combating shifts in consumer preferences, as well as the financial pressures that health systems and other DME referral sources are facing in today's changing environment. So Alan, with that being said, one thing that we commonly hear in the industry is how health systems are really focused right now on trying to create capacity. There's a lot of data out there that suggests occupancy constraints within hospitals due to rising occupancy and things of that nature. So could you just kind of touch on real briefly kind of what you see the value proposition for DMEs being able to play when it comes to helping improve access to care for referral sources?
Yeah, it's a big issue for health systems, and I think the role that DME plays is a little bit multifaceted, but really incredibly important as health systems are continuing to improve access to care by creating additional capacity. First of all, creating a sort of home-based healthcare ecosystem that's more highly connected than it's ever been before. So helping patients feel and actually be more connected to their doctor from their home than they've ever been before, whether it's technology embedded in home medical equipment or whether it's other maybe more retail-driven technologies. Patients can live their life at home and yet feel more comfortable than they ever have before, that they're connected to their care ecosystem, including doctors within the clinics and also maybe other caregivers that are in their life. But certainly that comfort and ability to stay in their home, feel comfortable in their home, creates additional capacity in other areas of healthcare. Maybe a little more tangibly, DMEs do things that are designed to help reduce utilization of other settings of care. So whether it's reducing emergency department visits, reducing hospital admissions and readmissions, reducing length of stay in skilled nursing facilities, whatever it might be, all of those things that DMEs do that reduce utilization elsewhere and move care into the home ultimately create capacity in those other settings. So creating additional capacity or relieving pressure in the hospitals and skilled nursing facilities is an important thing in healthcare right now. It will continue to be an important thing in healthcare as the population continues to age, to get older. So the elderly population that consumes the majority of healthcare resources, including in facility-based care, continue to expand. That the population's getting larger and larger, and hospitals are going to continue to be under more pressure. So everything that DME has done and continues to get better at that helps alleviate pressure and create additional access to care is a good thing for the healthcare ecosystem, and it's a story that DME should continue to tell, especially when communicating with referral sources.
Yeah, that's awesome. I like what you mentioned there about the aging population. Not only is the population that referral sources are serving aging, but also this ties well into our next challenge related to staff shortages. Healthcare is also seeing an aging workforce, so more retirements or folks that are approaching retirement age, which has presented challenges with staffing all across the country, across health systems. And it also leads to more spend related to contract labor and expense for paying contract staff. So health systems, as we know, are really focused on how to solve those staff shortages all across healthcare. But could you maybe touch on a little bit in terms of how DME can help show the value proposition that the industry has to tackle staffing shortages?
Yeah, absolutely. I love the question, the different hats that I've worn in my time over the last nearly 20 years working in healthcare. I've spent so much time with DME providers all across the country and just gained an understanding of how they work and what drives strategy and how they market themselves and things like that. But also my time spent working inside the health system gave me a perspective around this exact topic, what staffing shortages and staffing constraints mean to health systems, both financially and from a quality of patient care perspective. And I think it's largely been under-recognized both in the DME community and also in the hospital and other institutional care setting community, what the relationship between the two things really means. So I don't think that most people in the DME community recognize how hospitals and other facilities manage their staff on a day-to-day basis. So without going through some big, long explanation, what I will say is staffing is done in a really flexible manner that's designed to align directly with patient census. So if there are less people in the hospital, hospitals will staff down. If there are more people in the hospital, hospitals will staff up. And that's done on a day-to-day, not quite hour to hour, but multiple time per day basis. So when when hospitals see their census go down, they don't need as many people working in the hospital. So as it relates to DME, and you just think about the things that I just mentioned on the last topic that we were talking about, reducing emergency department visits, reducing hospital admissions and readmissions, so keeping patients out of the hospital, reducing length of stay, so timely delivery type initiatives that are designed to get patients out of the hospital, even so much as a couple hours earlier than they might have, all help keep the census in the hospital down, or keep the census in the skilled nursing facility down, and give the hospital the flexibility to use less staff during that time. So as hospitals feel more and more compression as it relates to staff, Tyler, you mentioned aging workforce and not enough supply in nursing and nursing related workforce, sort of backfilling that population that's been retiring over the last several years. Hospitals are just under a tremendous amount of pressure from a staffing perspective. So anything DMEs can do, doing things that you do so well, helps alleviate pressure for referral sources. And it's something, again, just like I said a few minutes ago, it's something you should absolutely be communicating to your referral sources when you're communicating with case managers or other leaders within a hospital or skilled nursing facility that you rely on for your business.
That's great insight there. Our next topic, building on that, talks about shifting consumer preferences. So this is really talking about the things that patients that are receiving healthcare services want to see from their healthcare. A couple of things include, convenience, easy access, short wait times, embracing the digital age with telehealth services, enhanced communication through appointment reminders and things of that nature. And this is something that, as we've discussed before, the DME industry complements really well, just with the shift in sites of care and looking at spend across the healthcare continuum, seeing the shift from traditional inpatient services to outpatient care and care in the home. Could you maybe talk a little bit about how you feel like our industry is positioned really well to capitalize on the site of care and consumer preference shift that we're seeing across healthcare today?
Yeah, love it. Been around DME for almost 20 years, and the mantra in our industry has always been that we're delivering care where patients prefer to be. So patients prefer to be in their home. DMEs provide services and technologies that are designed to keep patients in their home. We've said it forever, well before I joined the DME space. I will say for the most part, that's true. That said, when patients experience acute episodes, or they're in a period of their life when their condition is at its most acute state, has always been some degree of comfort for individuals to be near high quality clinical care, so in hospitals or other institutional care settings. And what DME's done in conjunction with tech companies and manufacturers within the DME space is continue to evolve itself and create an increasingly safer environment in the home that enables an even larger and larger population to stay in their home and feel comfortable in their home. So at a high level, of course, patients prefer to be in their home, but it's really all about providing an ecosystem in their home that makes them feel safe and comfortable staying in the place that they want to be. So absolutely, DMEs should continue to push technology to the limit and continue to create an environment that patients feel comfortable staying in their home. They should continue to tell that story to their referral sources. And then as it relates to referral sources, hospitals and physicians and whatnot, the other side of this is that probably now more so than ever before, and this has been building up over the last several years, but more so than ever before, hospitals and physicians have incredible amount of financial incentive to find the lowest cost, high quality care setting they can for their patients. So historically, hospitals and doctors for that matter, been paid on a sort of fee-for-service type basis, similar to what DME is typically paid for. So more patients in hospitals means more revenue, makes it easier to keep the lights on, makes it easier to provide high-quality service and things like that. In today's world, hospitals, physicians, and payers are becoming more and more aligned in their initiatives to try to keep patients out of the hospital and into lower-cost care settings, namely the home, as it relates to DME. So essentially what's happening is payers are sharing savings or sharing the financial gains associated with keeping patients healthy and keeping them out of the hospitals and in the home, or getting them out of hospitals sooner, getting them out of skilled nursing facilities sooner. When all things that save a whole bunch of money for payers, these payers are sharing money with DME's referral sources to make sure incentives are aligned to get patients home. So DMEs provide a level of value that they haven't before, and I think largely goes unrecognized in the DME space, in that they're keeping patients in the home, and that initiative or that desire to keep patients in the home is very much aligned with where the rest of healthcare is going. Again, another story that DME should be telling their referral sources.
Yeah, that's great. You had mentioned sort of the shifts in, fee-for-service and value-based care, which ties really well into our last challenge for referral sources that we're going to discuss today, really around the notion of the financial pressure that health systems have been facing in this period, post-pandemic, and as we're now, 5 years removed from COVID. Some of the key components related to financial pressures that we've discussed and seen are related to operational costs rising. So we already touched on, the cost of labor becoming more expensive. With that comes increased supply and drug expense for hospitals that they have to combat as those costs continue to rise. But also during those times of financial pressure, really seeing limited amounts of capital made available within the health systems for, future investments in technology and things like health systems have to be pretty fragile with how they're utilizing capital funds that are made available to them. So really to kind of tie this all together, could you just walk through a little bit for our audience how you feel like the value proposition for DME, what it is, how it can tackle some of these key challenges as the industry moves forward?
Yeah, absolutely. DMEs have been feeling margin compression for a number of years now. Reimbursement rates haven't kept up with the rising costs to doing business. You can make the same argument for a whole lot of industries, outside of healthcare even. Auto manufacturers probably make the same argument that cost of doing business goes up faster than what they can raise their prices. That said, hospitals and large clinics, integrated health systems, they're not immune to it either. Through COVID, health systems in general lost a whole bunch of money, operated at double-digit negative margins basically all across the country. Now, coming out of COVID, now we're a couple of years removed from really the effects generally of COVID as it relates to healthcare as a business. Most hospitals have gotten back to a point where or health systems, I should say, have gotten back to a point where they're operating at a positive margin, albeit much, much thinner margins than they've operated at historically. You get a lot of hospitals or a lot of health systems that are operating at a margin less than 1%, most under 3% for sure, which is half or less of what it might have been sort of pre-pandemic. And to your point, Tyler, what that means is just there's not a whole lot of money left to invest back into the health system. The capital dollars aren't there. And that said, they really don't have the ability to significantly grow the population that they're taking care of to offset some of the rising costs of doing business. These are, confined structures with finite amount of space and finite resources, finite capacity, and in a bunch of outpatient departments, things like that really just limit the size of the population they can take care of. So they've got to figure out how to navigate margin pressures and try to create some sort of operating margin that allows for investment back into the health system. So it's kind of a long-winded way of getting around to the idea that DME and the ability that DME provides to move patients out of these care settings and into the home without cutting into referral sources, revenue streams, just becoming essentially a cost savings entity by getting patients out of the hospital earlier or reducing readmissions and helping avoid readmission related penalties. All those things are a big deal to hospitals. They need to take care of these big populations. They need to do it efficiently, effectively, in alignment with, as I mentioned, payers, but also in alignment with their cost structure. And DMEs provide such an incredible amount of value to these referral sources that they rely on so heavily by alleviating cost pressures and ultimately helping these health systems create some margin that allow for reinvestment into the future of the health system, the future of healthcare. So yeah, really big deal that the DMEs have really stepped to the forefront, especially coming out of COVID, to showcase their capabilities in keeping patients at home right at the same time that health systems need that support more than they ever have before.
Yeah, I think that's a great point. And we had kind of actually talked just before getting on the podcast here about how these challenges are going to be around for a while in terms of affecting the healthcare industry and the future of the industry. So the more that DMEs can understand the value proposition that they have to tackle these challenges, not only DME providers, but the industry as a whole in a great position to capitalize on growth and innovation, which ties really well into kind of our conclusion here today of showcasing what Industry Insights is. We've got on our member portal, under the exclusive content, the branded reports and the blogs and podcasts that we'll be putting out there as we sort of launch this to try to help with strategic decision making and driving innovation within the industry. So really excited with what's to come on that front, and great talking with you today about some of the key challenges across the industry and the role DME plays within that.
Yeah, absolutely. Thanks, Tyler. Exciting stuff that we're working on here with Industry Insights as well. So look forward to engaging with all of you in the near future.